A 48-year-old woman presented to the emergency department with severe sudden onset of abdominal pain, which she rated as 9 on a scale of 1 to 10. She stated that the pain worsened with the movement and change in position. The patient noted that when the abdominal pain began, the pain in her leg became more frequent and of higher intensity with intermittent numbness. She reported nausea, paresthesia, sensory changes to left lower extremity. However, she denied diarrhea, headache, fever, back pain, and any urinary complaints. The patient had a history of myocardial infarction 3 weeks back, which was end-STEMI, and patient was treated with medical therapy. Regarding social history, the patient admitted to smoking half a pack of cigarettes a day and drinking alcohol socially. Medical history included colon cancer, claudication, and multiple abdominal surgeries. The patient has been diagnosed with stage 2 colon cancer 4 years earlier, for which she had undergone a colonic resection. During the physical examination, the patient was diaphoretic, uncomfortable, and in severe distress. Her vital signs and blood pressure was 147/77, respiratory rate was 18, heart rate was 129 beats per minute, and temperature was within the normal limits. Oxygen saturation was 94 on room air. The abdominal examination revealed a distended abdomen that was severely tender to palpation, with rigidity, gauding, and rebound tenderness. The patient had signs of diffuse peritonitis. Now, how will you move further for the right diagnosis? What is your probable diagnosis? What disease patient might be suffering from? What investigation can help you support your diagnosis? Is there any surgical option available for disease treatment? To know the answers of these questions, let's study mesenteric ischemia on sqadia.com in detail.